You know, nail fungus is a problem that affects roughly 36 million Americans and 10% of the global population. Today, we're getting an opportunity to chat one-on-one with one of the most esteemed physicians in the field about a new breakthrough in the treatment of nail fungus, Pinpointe foot laser offered by Cynosure.
Dr. Daniel Waldman, DPM and board-certified foot surgeon, is the founder of Blue Ridge Foot Centers in Asheville, North Carolina. He is the medical director of Carolina's Toenail Laser Centers in Charlotte, North Carolina. Dr. Waldman is a renowned expert in the field of podiatric medicine, and he's with us today to talk about Pinpointe foot laser. It's the first clinically proven laser device that treats nail fungus offered exclusively from Cynosure. Welcome to Aesthetic TV, Dr. Waldman. Thank you so much for being here.
Thanks, Brenda. Thanks, John, for having me.
Absolutely. Great to see you. You know, let's talk about this and nail fungus and where does it come from? What is it exactly?
Good question. Fungus is a really interesting organism. It's not exactly an animal or a plant. It's somehow in between, and it's opportunistic. It's been on Earth, for billions of years, and it's a very primitive life form, and it infects tissue and breaks it down. It gets into the toenails and it eats away at the keratin. And it's very difficult to eradicate once it gets into the toenails because your body can't really fight it off. It doesn't have a blood supply going directly to that dead layer of the nail.
Huh. Right,
yeah,
right.
So
it's alive though. It keeps growing and growing.
Yeah, it just keeps on budding off and spreading throughout the one toenail and then often to other nails.
Right, which was my next question. I've always wondered, is this transferable? And I'm next to my husband and he's been, he was a football player running around. Am I going to get that?
Well, if you haven't had it by now, there's a chance you probably won't.
Okay.
But it is somewhat contagious. Now, it's not contagious like catching the flu or a cold.
Right.
But you can pick it up in locker rooms. Like I said, if you're playing footsie, you get it.
Right.
The other place I see it a lot is people that have some nail trauma, maybe too tight of shoes over the years, or somebody that may have a deformed toe where it's hitting, or even just a small injury to a toe. Once that nail material loosens up a little bit, the fungus, which you got to remember is everywhere in the environment, it can get in there and take over.
Well, and also, when you go to the nail salons,
right?
Am I going to get that? I wonder when they're digging under my toes and cleaning and painting, I'm wondering, am I going to get something from somebody else?
You have to be really careful with that. You got to make sure the instruments are clean.
Right.
Big areas, the whirlpools, making sure that those are clean. But those are really big areas. I have a lot of women that will have perfect nails and they go to a new nail salon. And then a month later, they start noticing their nails
But
changing
you said
color.
Whirlpool. What?
Well, sometimes they put you in a whirlpool. That can harbor bacteria and fungus if they're not cleaning the filters properly.
How do you treat it? What are some of the treatments that have...
Well, in the past, we didn't really have a lot of really good options. Back about 25 years ago when I was in medical school, there were some medications, but they're very, very dangerous for the liver. And then back in the 90s, there were two other medications that came out, very good for treating it. But they also had their own host of problems, including liver toxicity. You could develop a skin rash. I even had some patients, they temporarily lost their sense of smell and sense of taste. Yeah, one guy was a chef, and he almost lost his job. He was over-salting the food so much. And
you're kidding.
Yeah, thankfully it was reversible.
Right.
But, up until we had the Pinpointe foot laser, which I really consider the gold standard now, there really wasn't a lot out there. And now with the laser, really no side effects to speak of. So I really don't even prescribe the medication anymore. I just don't feel it's worth risking a liver or other issues over a toenail.
And I think some of that earlier medicine, it only worked temporarily, right? I mean, sometimes the fungus would come
that's
back.
true. And fungus is going to be everywhere. Even after the laser treatment, I get my patients on a good home care protocol, keeping the inside of the shoes clean, using some topical antifungals, making sure that they're wearing flip-flops in the gym, just to make sure they don't pick it up again. But very often, if a patient's somewhat negligent, they can get it again.
But those topical antifungals that you give your patients are definitely nothing like the ones that were hurting other people's livers and
no,
kidneys.
the topical stuff aren't.
Right.
No. In fact, the Pinpointe foot laser's been used over 100,000 times. No adverse side effects.
See, that's amazing.
Yeah, and I just think it outperforms all the other methods out there.
Is this relatively new?
Pinpointe laser's been around for about 3 years. I think we got the FDA clearance a few years ago. And I consider a big part of my practice, big part of my armamentarium.
Well, and I think that's what people want to hear when, there's something relatively new. Obviously, new is like maybe 10 years, young.
Yeah.
They want to hear that it's effective, but it's safe.
Well, the nice thing about this Pinpointe foot laser, it's the first one to get FDA clearance for this treatment, and I've been using it now for 3 years. I'd say 80 to 90% of my patients after a course of treatment are very pleased with the results.
Wow.
And I am too. I've never been able to make somebody smile so much in my practice.
You know, when it comes to this, I bet it's surprising the number of men that are looking for treatment.
You're right, John. That really did surprise me. A lot of men will come to see me, especially guys that are maybe recently separated or divorced or back on the dating scene. And, you know, they want their nails looking better when it comes time to take their socks off. And then I have a lot of couples where the husband or wife will bring each other in and saying, look, you got to fix this. I'm tired of looking at it. So I feel like I've saved a lot of marriages and probably helped a lot of relationships. You know?
I'm sure that feels good, yeah.
It does, yeah.
Which brings me to the next question. What can patients expect when they opt for the Pinpointe laser treatment? What can they expect during a treatment? Does it hurt? Is it painful?
Good questions. I get asked that a lot.
Right.
I always reassure my patients that, you know, it's not going to be extremely painful.
Right.
I let them know that it's going to heat the nail up.
Right.
I let them know it's going to gradually get warm
Right.
and warm and warm. And, you know, they let me know if it's getting a little bit uncomfortable. We try to avoid any little hot spots, but occasionally they can happen. They go away very quickly within a matter of seconds.
You can walk afterwards.
Oh, they don't create any damage.
You can
yeah,
walk?
Yeah, that's another thing. There's no restrictions afterwards. I tell
Really?
patients, yeah, go to the gym, go swimming if you want.
No.
Yes.
Really?
Yeah, but they just have to take care of some of their regular foot hygiene
Right.
afterwards, as long as we get them back into like a good habit of taking care of that correction. Now, keep in mind, the nails are not going to look dramatically improved after the first treatment. It depends on how fast the nail grows out,
Okay.
how extensive the infection is.
Right.
So there's times I do actually, you know, multiple treatments spread out over a course of a few months.
Okay.
And no anesthesia is needed?
No, none at all.
That's fantastic. Now, how long does the treatment last for somebody that goes in to get this
On
done?
average, to do all 10 nails is going to take maybe 30 minutes, maybe, you know,
Wow,
give or take.
that's fast.
Doesn't take very long.
Lunch break.
Yeah.
Lunch
yeah,
break.
exactly. Lunch break, even after work and they're back home.
Right.
Yeah.
So you're saying, you were talking about shoes. You know, we women, you know, wear these shoes that are a little, you know, tighter, a little more narrow
Sure.
these days, getting taller and taller. Is that maybe going to affect?
Well, it can, because anytime you put the nail under some stress, like biomechanical stress, where the nail's maybe getting pinched or
Right.
too tight, I've seen a lot of people where they have a long second toe.
That means you're smart, because I have that.
It also means you're the boss of the family, I heard.
Oh,
the
see?
same-
Because
it's
I
the
have
same
that.
thing, yeah.
Yeah.
Yours is short, right? But I have that. Go ahead.
But anytime you have that long toe, it could be jamming into there. People
Okay.
that maybe have some arthritis in their toe where the toe doesn't bend and it jams against the shoe too much. So there's usually a precursor event that's going to weaken the nail. And sometimes people don't even remember it. Sometimes even a little trauma or a nail being
Right.
too long, you know, it serves as a way for the stuff to get in there. The fungus can get up there and really set up house.
Okay, so the Pinpointe foot laser is designed specifically to treat nail fungus, right?
That's right, Brenda.
Okay.
This is actually the only laser that's ever been designed just to treat nail fungus.
Okay.
All right, and it's very simple to use. It's got a fiber optic in here that shines a red light, which is like an aiming beam, and then I'll simply place it over the toe, and with a foot pedal, I'll turn the laser on while we're working, and I just move in a pattern going up and down the nail, very slow, and I usually do 2 passes
Oh, that's
over
it.
the nail, and then I'll go on to the next nail.
Really?
It's very simple, very simple. Now there's some prep we do on the nail to thin it out a little bit if it
Okay.
needs to, and all that. And then
Any
after,
creams that-
Well, afterwards, I like to protect what we've done by having the patient use some home care products. Again, very simple to use. I tell people if you brush your teeth twice a day, you can take an extra 30 seconds and do something with your toes. So I say
Right.
teeth and toes.
I want to get to some before and after photos that you brought.
Right.
So I kind of want to see what this looks like and what it can look like and what people can expect after treatment with this machine.
Yeah, let's take a look. John, just be prepared. Brenda, be prepared. Okay, we're going to see some pretty rough looking
Scared,
nails
okay.
here. Okay, so over to the left, we see a nail before treatment. You can see it's yellowed, it's somewhat brittle, crumbling. And then this is 6 months after the laser treatment. You can see it's clearing up quite a bit, especially from the base of the nail.
Right.
The success really depends on how fast the nail grows out. The faster the nail grows, the quicker we see a result. So that is a rate-limiting step. So you'll see more clearing coming up from the base where
How
the
many
cuticle is.
treatments generally are we talking on these nails?
It depends on the severity. You know, if you get a really light case, very often 1 treatment can do it. I found in my practice, sometimes I'll do 2 to 3, and maybe even a 4th treatment down the road.
Yeah.
Because nail fungus, it just forms spores, are very difficult to kill.
Right.
So the lasering will kill the active fungus, but if there's spores left over and they start to blossom up again, then I do like a booster dose a few weeks later.
But it looks like the nail's almost going to fall off, but you're
Yeah.
saying no.
Well, a lot of times the nail's loosened up
Right.
at the tip. In fact, this nail over here
Yes.
on the left, we can see it's darker.
Right.
That darkness is either, you know, it can be some debris from the sock or even some dry blood under the nail, and it'll loosen up. So very often we'll trim a lot of that away and just
okay.
reduce, you know, that fungal load on the toe.
Okay.
And then you can see how it's growing out after 6 months.
It's painful, isn't it? I mean, when you get fungus that severe under your
It can
toenail,
be.
Is it painful?
It can be if it's thick. You know, it's like taping a pebble sometimes. But very often I'll see a flat, normal-looking nail that'll just have a lot of discoloration in it. You know,
Really?
a lot of times it starts very insidiously.
Right.
You know, a
You
little
can't see
white
it.
area, right? A little white
Right.
area or yellow area, and people just think, oh, you know, I just got something under my nail,
Right.
or I bumped it. But very often that is the start. And really, the earlier we catch it,
Yes.
the quicker we can get a result.
Yeah.
And you know, expensive. It's not near as expensive afterwards either.
Right, right.
Yeah.
So do we have more photos?
I
Wow,
think
look
we
at
have
that. It's yellow. So there's different colors.
Well, it depends on the lighting too, but there's the main germ that infects the nail is called Trichophyton rubrum.
Okay.
And that's a Latin name. It just means red fungus because that's how it grows out in the dish. But very often, depending on the thickness of the nail, even the patient's complexion, it can have a different diffusion of the light through there.
Yeah, I can really see how someone would say, oh, this will just go away. I don't have to
Right.
worry about this. But it just keeps getting worse. It's not gonna
Yeah,
go
you know, problems like this, they can either stay the same, get better on their own, or get worse.
So from what you're telling us, the Pinpointe foot laser is the best laser treatment for treating nail fungus and the most effective, right?
Right. In my opinion, it is. When you think about it, this is the only laser that's actually been designed for treating toenail fungus.
Right.
Other lasers are on the market that are, you know, been used for hair removal, wrinkles, things, and you know, they're still being used. But this laser has been researched for 5 years.
Right.
It's patented design on the frequency of how the laser is firing. It's extremely painless, and it's very effective.
Doctor, thank you so much for joining us today. This has been great.
Thank you.
If you're interested in trying out Cynossure's Pinpointe foot laser for yourself, use the Physician Finder on aesthetichtv.com to locate a doctor in your neck of the woods. Thank you so much for joining us on Aesthetic TV, where we keep you looking and feeling your absolute best. We'll see you next time.
Stay tuned.